Okay, now the next tutorial after infections, you're going to now visualize the pathogenesis of infection. Pathogenesis of infection. Now, the pathogenesis of infection is generally microorganisms. Microorganisms. Now, I wish to divide generally microorganism for you to understand. Now you need to know that what the microorganism can either be, the first one is viral. You have viral microorganism which can be the pathogenesis of infections, basically, or pathogenesis in any microorganism resulting to an immune response. Basically, that is what is called infection. So the microorganism can either be viral one. The second microorganism in the pathogenesis of infection, we are going to have bacteria, and bacteria are the most common one. So the one that are generally causing infections are viral, but viral infections are going to be treated by the body directly. They are generally treated by the body. Most viral infections, basically, there are some viral infections that are not treated by the body and need medication. So most viral infections, though they are majorly involved with infections, particularly in children, they are going to be self-limited, meaning that the body is the one that control those type of infection, particularly in children. Basically, now bacterial infection are the most common infection when you are entering into the young age, young children and adulthood. Basically, in adolescence and adulthood, the bacteria are the one that are now much more prominent, and that's why I'm going to emphasize on a particular classifications of bacteria that you need to understand and understand it very well. Basically, now the third one after bacteria, we are going to have parasites. Basically, parasites are also microorganisms involved. You need to know that well, generally parasites are going to be divided into two. Basically, for the parasites, you are going to have division into two. You are going to have the first one, which are the protozoans. Basically, the protozoans are involved in infection still, and then we have other parasites like worms, and the worms are also involved in infections. You need to know that there is also classification of worms that you need to know. Basically, and this classification is going to be very helpful. Basically, now the four types of microorganisms that you have, basically you have also what is called the prions. Basically, the prions are other types of microorganisms, and these prions are just like proteins, but these proteins are capable of resulting to an immune response. Basically, these proteins are capable of resulting to immune response, and this is the peculiar situation where you're going to have prions is in the case of a Creutzfeldt-Jakob syndrome. Basically, in the case of Creutzfeldt-Jakob syndrome, this is generally a situation where prions are being transferred from one blood group, one blood to from a blood donor to a recipient. Generally, when this is a very late complication of blood transfusion. Basically, a very late complication of blood transfusion is Creutzfeldt-Jakob syndrome, because in this case, when you are transfused, you can have a transmission of prions which is not detected by the modern, techniques. Basically, so it's resulting to an encephalopathy. It results to a neurodegenerative. It is result to a neurodegenerative encephalopathy. Basically, encephalopathy, which is going to result to dementia. Basically, later on in life, the patient is going to have dementia. That is the Creutzfeldt-Jakob syndrome. And also, Creutzfeldt-Jakob syndrome also occurs in cases of people who are cannibals, because cannibals are going to eat prions in the human body that they are eating. Basically, so if you have one human being eating another human being, you can still have a transmission of these prions, this Creutzfeldt-Jakob syndrome. So generally, that is the pathogenesis of microorganisms. Is it clear? Now, the next part we are going to visualize now is going to be the classification of bacteria. This is a classical tutorial that is going to be according to SchrDbb, and this information is going to be revealed only under its name.